Good afternoon. Today is Tuesday, March 17th. Happy St. Patrick's Day. You are in the Senate Finance Committee. Today is all voting, and we're going to start. I understand there is a request for a reconsideration.
Thank you, Madam Chair. I'd like to, I move to reconsider the vote by which Senate Bill 786 passes committee.
Do I have a second for the reconsideration on Senate Bill 786?
Second.
And Senator Kramer seconded. Do we need a vote on the reconsideration, Tammy?
Yay or no?
Is somebody going to explain it?
Lisa will.
Okay, can we remind us what 786 did, please, Lisa?
Senate Bill 786 exempts a transportation network company that contracts with the Maryland Transit Administration to facilitate the provision of transit services to persons with disability through transportation network operators from the general requirement that individuals who provide transit services to persons with disabilities receive a state and national criminal history records check, and instead requires the contracting transportation network company to conduct an annual background check of each operator that provides transit services to persons with disabilities. The background screening must meet specified requirements and existing provisions of the public utility articles that require a national criminal history records check and a driving record check as a condition of licensure as a TNO. There's two amendments. Amendment 1 is technical, and Amendment 2 requires the transportation network company to provide information and training on laws regarding non-discrimination and accessibility.
Do you remember, you may remember when we had the hearing on Friday, something came up. Senator Mounts said, oh, there was just some information that came out. Well, and I asked, what was the information? I've gotten some information, Senator, and I've become uncomfortable with the bill. The number one thing is the lack of fingerprinting. Uber says these are not their employees, and so they will not require fingerprints. A lot turns up in the fingerprints. There is a company in Maryland working now that does fingerprint their folks. Do not require that vehicles be cleaned after a dog is in the vehicle for someone with disabilities. They do about 150,000 trips a month already. So it's a perfectly acceptable company that does do the fingerprinting and is doing a really good job. I just have real concerns about the lack of fingerprinting. So I guess we take another vote. Do I have a motion favorable as we reconsider Senate Bill 786? Is there a motion favorable?
To reconsider.
No, we already voted to reconsider.
So everything is favorable?
I guess we're, if no one motions,
Or is
Right.
just no motion?
if there's no motion, then it's just done. No motion? Does anybody want a motion favorable? Okay, thank you. That takes care of Senate Bill 786. We also, we voted, pardon me? Okay.
There's a few others I'd like to do that too.
Feel free. We already voted on Friday to reconsider Senate Bill 910. Is there a motion favorable now for Senate? No. Oh, Lisa's going to explain Senate Bill 910. Thank you.
Senate Bill 910 requires certain health insurance policies that provide reimbursement for a service within the lawful scope of practice of a licensed graduate professional counselor, licensed master social worker, or licensed psychologist to reimburse for the service provided by a graduate level clinical counseling clinical intern, graduate level social work clinical intern, or graduate level psychology clinical intern under specified circumstances. There was an amendment, and it would add marriage and family therapists, drug and alcohol counselors, and professional art therapists to the scope of the bill. And there's an additional amendment that we did not include on Friday that is now being offered by the sponsor of the bill that would clarify that for a licensed graduate professional counselor, the services are reimbursable whether they are supervised by a professional counselor or professional social worker, which they are authorized to do under current law.
So is there a reprint?
We don't. I just got the second set of amendments, so we do not have a reprint of that one. You should have a reprint with the amendments from Friday incorporated.
Senator Mounts.
Thank you, Madam Chair. I just would take a second to explain, because I let this go on Friday. We were in a hurry trying to move through things, and I didn't realize that first set of amendments were included in the bill, which is where the motion to reconsider this, and now here we are today. So the first set of amendments that were explained were the ones that are controversial. This is a very narrowly tailored, specific bill, just specifically for behavioral health. And the amendment that we're adding today was just provided by the House. So the House voted the bill today. And what it does is it further narrowly tailors the bill to how these interns can operate. And it talks about who can oversee them and that sort of thing. It's a short, it's a paragraph, just explaining who can oversee the interns. Can I move favorable?
You can, Senator. Do I have a second? Do I have a second for the favorable? I'm sorry. Second, Senator Reedy. I have a question. So if we pass it with the amendment that Lisa just described, does it then, in the same posture as the House bill?
It will be identical.
Thank you, Senator. Do you want a roll call? Do a roll call, Tammy? We had a motion and a second.
Senate Bill 910, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
Yes.
Yes. Senator Mount.
Yes.
Yes. Senator Jackson.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb. Yes. Senator Hershey. Yes. Madam Chair.
Yes.
Yes. Unanimous.
Unanimous. All right, now we're going to turn to Lisa. Okay, Lisa's going to do her bit.
Okay, Senate Bill 530 is the first one. This authorizes the Maryland Department of Aging to make grants to nonprofit organizations and area agencies on aging to support social connection for individuals in aging in place programs through events or gatherings at multi-generational third places. There are no amendments.
Can I have a motion for Senate Bill 530?
Yes. Move favorable.
Thank you, Senator Gall. Do I have a second? Senator Jackson. All in favor of Senate Bill 530? Senator Hershey? You in? Unanimous vote. Thank you.
Okay, Senate Bill 623 is next. And this one authorizes a local board of licensed commissioners in the state to issue a Class C PCL license to the holder of a tobacconist license. The board may issue one Class C PCL license per 150,000 residents of a county. The license authorizes the holder to allow a customer to consume alcoholic beverages on the premises Monday through Sunday from 10 a.m. to 1 a.m. the following day as specified conditions are met. The licensed premises is exempt from the requirements of the Clean Indoor Air Act under the provisions of the Health General Article. We have a set of amendments from the chair, and we also have a set of amendments from Senator Lamb that I was not able to incorporate in the other one because we got them today, but you should have a reprint of both sets. I can walk through the chairs first. That ID number is Senate Bill 623-223-626 at the top. What this amendment does is it separates out the CPCL license from the BYO license. So now a local licensing board can issue the CPCL in order to sell alcohol or authorize them to do BYO. For the license, it applies to a tobacconist, and later on in the bill, the amendment of the definition of tobacconist is amended so that it requires that 70% of their sales are for premium cigars, pipe tobacco, and related accessories. There's an amendment saying that a Class C PCL license holder cannot have a commercial kitchen located on the premises, and that a local licensing board cannot issue a new license within 5 miles of an established CPCL license. Again, it allows them to sell for consumption alcoholic beverages. It requires that the products consumed while the person's on the premises are premium cigars or pipe tobacco sold by the license holder. If someone is applying for a CPCL, they must submit detailed specifications for air filtration and exhaust systems. And the signed acknowledgement that employees are required to sign is required to also enumerate the dangers of secondhand smoke and state that the employee will be subjected to secondhand smoke. The amendment also requires a license holder to submit a statement of average daily receipts and an affidavit of a public accountant to specify that they've met that 70% threshold, and they have to send that to the executive director of the ATCC. The amendment also prohibits a person from using cigarettes, electronic smoking devices, or cannabis on the licensed premises. This also changes the licensing fee. It was $100 in the original bill, and now this allows the local licensing board to set the licensing fee at a rate between $500 and $2,500. The next section that's at the bottom of page 4 onto page 5 establishes the procedures for BYO. This would allow the tobacconist to apply to the local licensing board for a permit to allow people to bring alcohol for on-site consumption. If they do allow it, the customer has to be at least 21 years old, and they have to be concurrently buying and consuming tobacco products. And the owner may limit the type and amount of alcohol that may be consumed, requires employees to be trained in alcohol awareness, and has certain limitations about the hours of consumption, prohibits cigarettes, smoking, electronic smoking devices, and cannabis on the premises, and prohibits a license holder from allowing customer to disturb the peace and safety. And the licensing board is also required to notify ATCC if there is a tobacconist that is authorized to allow on-premises consumption. Okay, going on to page 6, you can see the amended definition of tobacconist that now requires 70% of its revenue to be from premium cigars, pipe tobacco, and related accessories. Later on, again, someone who applies for a license as a tobacconist is required to submit certain plans about air filtration and exhaust systems. They have to display that smoking is allowed on the premises, and they have to keep their daily receipts for a minimum of 2 years. Going on to page 7 of 9, the prohibition on a license holder being adjacent to a healthcare facility or childcare facility is changed to sharing a wall with them. And this also adds a provision that allows an existing tobacconist that has a childcare or healthcare facility move next to it can still have their license renewed. Someone with BYO is also required someone who is a tobacconist is required to file the statement of average daily receipts to show that they meet that 70% threshold. And then finally, I'm missing the last page on mine, but there's uncodified language specifying that if a alcoholic beverage license was held by a tobacconist prior to July 1st, 2024, that will be automatically converted into the Class C PCL license. And they have until July 1st, 2028 to comply with that requirement about the 70% of sales. And it specifies that any of those converted licenses will count towards the license cap established that's at 1 per 150,000 residents. That's the end of the chair's amendments. There's a second reprint that had Senator Lamb's amendments incorporated. Do you want to take a break?
Let me take
Yeah.
questions on this and I guess vote these amendments, and then we'll do the next set. It's a lot.
Yeah.
Okay. So I'm going to start with Senator Washington.
Thank you, Madam Chair. And thank you. I know the sponsor worked really hard on this bill, and they had a study and a work group for this. I just have some questions about the selectiveness of the selection process of who receives a license. For instance, there's some counties or areas that do not have a license, so they won't be able to convert theirs automatically. And so these will be open to the public to apply for them. And I wondered, what is the selection process for giving these to an applicant? If it's just 20 applicants, how do they decide? Do we put that in law? I didn't hear anything about promulgating regulations. I did mention this during the hearing too, about that process, and I wondered if the amendments here cover any of that.
It'll be your local liquor board. They'll actually issue the license.
I think that's the problem that I have, is because I did talk to our local liquor board today about this bill, and they mentioned that if it's not in the legislation, they will automatically, they can just award it to anyone that applies. And I think that becomes just, something that we don't want, because we want to be very selective about these licenses, because in our county, there will only be like 6 or 7 of them. And so I would want to make sure that we're being selective of what businesses taking them, how they're using it, and what they plan to invest in that community, and the economic benefit of that business to the greater community at large. So I'm concerned by that selection process, that we don't have language in there for them to promulgate regulations, because we don't even have that in there for them to promulgate regulations on selection or anything. And so I think that really concerns me a lot.
And so did the amendment go in about the 5 miles apart? Okay, so that's the one issue, is they can't be any closer than 5 miles. And 150, as you said, you have a limited number, 150,000.
Yeah.
But that's like local licensing to get, we're trying to address the Clean Air Act. That's why we have the bill.
You are, but you're also opening up an ability for my county to have these licenses to businesses that our community doesn't have a say in whether or not they want to be there or not, want them to have them in our communities or not. And my board has told us that if we don't put it in the law of what the selection process should look like, they will go by the standard process to select them, and that's on a first come, first served basis, essentially.
So
And
your local county council doesn't
we
want
don't
any say
oversee.
in that?
No, we don't. Only the state oversees our local
So-
authority. And if we could, add some language, I would like to have some language in here about the selection process and what should be considered. I mean, I know that's different for every county, and we're talking about every single county, but I have angst about my board saying that they would have to give it on a first come, first served basis.
So let's finish the questions,
Okay.
and we'll come back and probably hold the bill for tomorrow's voting session, but you'll need to get amendments ready,
Okay.
because
Okay.
it's, tomorrow's
I understand.
Wednesday.
I didn't know it was on I didn't know it was on here
Okay.
till today. So.
Okay, thank you, that's fair. Senator Lamb?
Yeah, I just have a technical question that's something just to piggyback on Senator Washington's point. I know on page 5 of this reprint, it looks like the more than 30% retail tobacco provision was removed, but I guess because you had said on page 3 there was this greater than 70% of sales provision was included, that effectively does the same thing? Is that right? I just want
there
to
were
make sure
multiple
that.
places that had been
Yeah.
incorporated, and I think it ended with the definition of tobacconist has that in there, and that's why that was struck, has the 70%, and that's why the 30% was struck in the other places.
Okay, so effectively the same effect. Okay.
So if I can ask, Lisa, that 30% includes all incidentals, not just alcohol, right? If they're selling like clippers or the actual pipe?
So the 70% includes premium cigars, pipe tobacco, and related accessories.
Okay, that's where that is. Okay, just wanted to clarify that. Thank you. Senator Kramer? I'm sorry. Oh, I'm sorry.
A
Now-
follow-up on that. On that provision, that's helpful. I think on some of this these local provisions have some concern about Howard County. We've been trying to be very judicious about this. Our delegation has not talked about expanding this to allow for these types of facilities. We don't have any in Howard County. My preference would be to exempt Howard County from this. Happy to bring an amendment if that's, something for tomorrow. But, just wanted to at least put that out there.
Senator, there's no requirement that your county would issue these licenses. It'll be up to your county. So if they don't want to issue the license, they don't need to.
Right, but I think similar to alcohol laws, we kind of set those, boundaries and standards and requirements. And we haven't, as a delegation, talked about whether we want to expand this to our county or not. So just.
But my answer is you don't have to. This does not say you have to issue licenses, one for every 150. It doesn't say that. It leaves it up to the county to promulgate how they want to issue the license. Now, I understand Senator Washington wants to give some guidelines if they're going to issue a license, but there's no requirement that they issue a license. Isn't it
Well-
Howard County that has the BYO?
I believe so. Like, generally,
For
cigar bars?
For cigar bars.
I believe so.
Howard County already has BYO for cigar bars.
I mean, I'll check on that.
Okay.
I'm hesitant to allow it into the county when we haven't had it already, and not having had a conversation with the delegation about it. I understand that the locals can decide not to, but we're a gatekeeper in all of this too. And if we as a delegation don't feel like this should be a decision deferred to the locals,
So Senator, we had a moratorium on issuing any new licenses for these that ended July 1st of this year. It is now the Tuesday before crossover. So if we want to limit these and the issuing of these, we need to pass a bill, or else liquor boards can continue to issue those licenses.
I have no problem with the broader bill.
Okay.
I just would like to exempt Howard County.
There is also the language that's at the beginning of the bill. It's the first line on the reprint that says, subject to Division 2 of this article and any local regulations, this applies statewide. So some of the drafters and I have interpreted that to say that each county would have to come back and adopt their own local provisions under Division 2, and this wouldn't really authorize any licenses until the counties come back and do that in a subsequent session, if they want to at all or not.
So let me just get that straight then. So in that interpretation of that provision means that even if we were to pass this, there would still need to be, similar to alcohol laws, enabling 2 specific counties?
Yeah. Yeah.
So the counties could not just, even if we were to pass this, could not just decide on their own to start it. They would need us to put an enabling to allow the local.
That's how we interpreted that provision in the amendment, yes. That's the, it's page 3 of the reprint by the handwritten pages. It's provision A in section 4-1002.
Say that again for me, please, Lisa.
4-1002, it's on page 3 of 9 on the reprint.
So line 10?
Yes.
Is that what you're referring to? How do you interpret that, just to, maybe you can just reinterpret that? Like,
So this was a conversation I had with the drafter who knows more than I do about this, so I'm hoping I'm explaining it clearly. But Division 2, I guess, supersedes Division 1 of the alcoholic beverages and cannabis article. And so if they're saying that they have to comply with Division 2 of the article, there would need to be some sort of analogous provision to the local, adopted under each local provision in Division 2, in order for the local authorities to adopt this.
so, I mean, I guess maybe to the chair's point, so there are some that exist already in the state, right? And so if we were to pass this, under this provision, you still need, those localities still need local legislation to essentially allow those cigar bars to exist?
With that provision in the amendment, they would.
The provision, this provision and the, which amendment are you referring to?
With that A in 4-1002 that we were just talking about.
Subject to Division 2 of this article.
Oh, this is an amendment, this is added in?
Yeah.
Oh. Okay, I guess that solves my problem.
I would like for you to check with your county liquor board and
Sure.
see if they have BYO already, because
Yeah, I'll check on that.
I remember hearing there were a couple in Howard County. We didn't know we had any Anne Arundel, did we, Senator Guile? And then suddenly we found out we had 2.
That was interesting.
Let's see, Senator Kramer.
So, couple of questions. In the bill, it indicates a local licensing board may authorize the owner or operator of a tobacconist to allow a customer who is at least 21 years old to bring alcoholic beverages into the premises for personal consumption. Is that legal now? Explain to me what is the status of that right now? Can they do that now? And now we're requiring them to be licensed? What is the status?
So
What's current?
Currently, it's if the county authorizes BYO, then I believe they are allowed to have BYO at a cigar bar. Like, for example, Anne Arundel doesn't have BYO generally, so you can't at a cigar bar in Anne Arundel, but a county that did have BYO, they
And
would.
does that come from county council or does that come from liquor board?
I believe it's from the liquor board.
Okay. Now, under the bill, you can get a license to do this. Will this also have the same limitation that the one that says you can sell it? Or in other words, we've set up this limit of however many 100,000 people and within 5 miles. Is that exclusively applicable to if you're selling alcohol in your place, but any tobacco lounge, any cigar lounge can get a license to let people bring their own? Or are we restricting that also?
Yeah. Yeah, I guess it's not technically a license for the BYO, it's the county authorizing it, but yes, anyone could ask the county for the authorization to allow BYO at that point.
Okay, and there won't be a limitation on,
No, that doesn't have the same restrictions like with the 5 miles or the number of residents, that
Okay.
the limitation exists on the selling
okay.
license.
All right, and I am just curious in the conversation with Senator Lamb, this discussion of it's up to the jurisdiction. Once again, is that going to be through the elected government as to whether you can do this, or the local liquor board to determine if you can get a license to sell? In other words, he was talking about the possibility of exempting Howard County, and the discussion was, it's up to your jurisdiction. But when you say that, is it our elected government making that call, or is it the liquor board making that call? Because I think there's a significant distinction between the two.
I mean, I guess it'd be like any other alcoholic beverage license at that point. The ones that would have to be like adopted or established by the legislature would have to do that. But as far as the discretion to issue them, that would be left to the local licensing board.
Okay, so our local government would not weigh in on it. It would be the local liquor board just decides, yes, we're going to issue a license, or no.
Yes, I believe so.
And is there the possibility of giving that discretion to our local jurisdictions to then determine? I mean, is that something, I'm trying to understand if this totally upsets the apple cart, to say a local jurisdiction, either Howard County or Montgomery County, that the elected, our elected officials make that decision as to whether they want, and then, of course, the liquor license, the liquor license board then determines if they meet the standards or qualifications, et cetera. But just as far as a policy,
Yeah,
or is this going to be, does that create chaos?
Yeah, I'd have to look into that just because I'm not sure which bodies have been delegated all the different aspects of legislating alcoholic beverages. So I'm not totally sure, but I can look into that.
Okay. I mean, if you would, and we're already going to be holding the bill,
Yeah.
could we maybe do that and just try to get a handle on it? Okay. All right, thank you.
Thank you. Lisa and I have probably talked about this bill every day since session started, so what's one more day? Senator Reedy, you're next.
I have a little bit of a different tack. I was just curious about the range of license, 5 to 2,500. Just seems kind of high on the 2,500 side. Was that something? Is the sponsor? I mean, it's the committee's bill now, but is that something that just came out of discussions with different people as to what the cost would need to be for the license, or we're going from 100 to? It just seems kind of high. I'm just throwing it out there. Okay. The amendment makes it, they can make the license between $500 to $2,500. Oh, I'm not arguing. I don't mind it being higher than 100, but I don't know.
It's going to take a few more inspections, I think.
Well, that's true.
Inspector's time.
I thought the chair's amendment said that the board may set.
I just thought that the upper payment limit on that was a little high. So I was thinking of a PDAB for a.
Maybe if a board wants to keep them out of their county, they make it 2,500.
Fair enough. Okay. I'm just trying to do a job. I'm just a job creator, Madam Chair. I'm just working on job creation.
Okay, is that it, Senator Reed? All right, thank you. Senator Mounts, you're next.
Thank you, Madam Chair. Just a quick question, and I don't recall during the hearing, was there any discussion about limitations on entertainment?
I don't believe so, no.
In my county, that's a separate license.
Yeah, and it gets a little hairy or tricky when you get into live entertainment. I just
Okay.
didn't know if that was discussed at all. And I know we're bringing this up tomorrow, so.
Okay, well, we could put no live entertainment.
Okay.
I mean, that's an easy fix. I have trouble, I mean, the size of the store is limited, right? Did we lim-
Or
so we
no, I
lim-
don't think no, we
No?
didn't do that.
Okay. I just have a problem seeing people with, it could happen, with minimal, 30% can be liquor, no commercial food, no commercial kitchen, and they're gonna have entertainment. It's an interesting concept. But no, we can put that in. That's an easy amendment. Senator Jackson?
Thank you, Madam Chair. So Baltimore County uses a quota-based system based on population by election district. And so I'm curious if this bill, if it passes, does it override the areas that do not have licenses available based on population quota charts?
You mean for the counties that have less than 150,000?
I'm assuming all of the licenses are occupied in Baltimore County. Does this create a new set of licenses?
So if they're an existing establishment that has a liquor license and is a tobacconist already, under the bill, their license should be converted to that new status, but that would count against the quota in your county. So I guess if there were already 10 establishments operating and your county already has 9, all 10 of those would be converted, but then they couldn't issue any new ones because they've already met
their
that cap.
licenses would just be converted?
Yeah.
Okay. Thank you.
Senator Gao?
Yeah, thank you, Madam Chair. Lisa, I thought I heard that there was like one county that would have been already over. Am I right?
Maybe Calvert.
I think that's what I heard too. Is that right?
Calvert or Charles?
Yeah. So what does that mean then if they let's say hypothetically the county is only supposed to get like 3 and they're already at 4? What does that mean for is it whoever gets there first with the application, or what does that mean?
That means there would be a problem because B and C would conflict in the uncodified language. Because it says that they may, or A and C, because it says that they have to convert the licenses, but then the licenses count towards the total number. So if they were over that, they couldn't issue more. And I guess it doesn't specify how you decide at that point or who gets priority.
Okay. So I guess we should probably find that out between now and tomorrow. Okay. All right. Thank you.
Did you have a question, Senator Hershey? I mean, I don't want to leave you out.
Proved it favorable.
Obviously, we'll work on it, and maybe it'll be back tomorrow. Maybe it will be back Thursday. Please, if you have ideas for amendments, get something drafted so we can discuss it. Okay? You're going to talk to your delegation, Senator? Okay. Let's discuss Senator Lamb's amendments while we're on the bill.
Did you want to present them or did you want me to?
So in your packet, there's a second version of 623 that does not have the handwritten pieces in it. So these were amendments that I had offered, and I think most of them have actually been already incorporated by the chair. There are only 2 that I just wanted to kind of highlight for folks for consideration. So one of them is on reprint page 3 at the bottom. This is in line 29, paragraph 1. It would not allow individuals under age 21 into these facilities. The under 21, they're already not allowed to buy. So just wanted to make clear that we don't really want them hanging around in the facility, just, kind of inhaling the smoke and such. So, or being accidentally sold to. So that was one provision. I don't know if folks have thoughts on that, but it's really just a hard provision on prohibiting those under 21 from going into these cigar bars. The other provision is on the cigarette restitution fund on reprint page 5. It's about 3/4 of the way down the page. And it just specifies that the any new money that comes in from this should go to the cigarette restitution fund to be able to support things like tobacco cessation and whatnot, that that fund is always strapped for money, and this seems like a natural nexus point if this is for cigar bars, for the funding to go to funding tobacco cessation programs and care. So I think the other amendments that were proffered in this version are, for the most part, adopted in the chair's amendments, but wanted to put those two out there for consideration.
My only comment about the cigarette restitution fund is that we've excluded cigarettes. So they can't sell or smoke cigarettes in the facilities. It's cigars and pipes. So
That's true, but it's for the same type of medical conditions that you would have for, whether it's smoking cigarettes versus smoking cigars. The intention of the Tobacco Restitution Fund is really to help with people quit smoking of whatever tobacco products, whether it's e-cigarettes or cigars, cigarettes.
and that would be the tax on the cigars, right? That would go to the cigarette restitution fund?
Right.
Okay. Do we have any idea what that, I don't know what
I
kind
don't know
of.
what that.
It's the sales and use tax on the alcoholic beverages that are sold by the license holder.
Why isn't the sales and use tax on the cigar? Is that the way the amendment's written, you mean?
Yeah, that's how the amendment is drafted, is that it would be the sales and use tax that was collected from the sale of alcoholic beverages by the holder of the PCL license.
We're holding the bill for tomorrow. If you meant for it to be on the sale of cigars, that needs to be fixed, okay?
What about the 21?
I think that's good. I don't know what it is now, who hangs out, but why not?
Yeah, they should be in the facility.
That's right. Thank you. Okay, any other discussions on Senate Bill 623? Thank you all for lively discussion. Lisa?
Okay, Senate Bill 731 clarifies that the Maryland Statewide Independent Living Council is a tax-exempt body politic and corporate. There are no amendments, and no fiscal impact, and no opposition at the committee hearing.
Senator Washington, who wants to second? Senator Bowden. So we have a motion and a second on Senate Bill 731, which has no amendments and no opposition, right? Was there any fiscal note on it?
No, it was just clarifying language that when they adopted this last year was not included, and it led to some uncertainty about whether they were tax exempt, but the intention was for them to be. So no, there's no fiscal note.
Okay, no fiscal note. We have a motion and a second. Should we call the roll, or are we all in favor? All in favor of Senate Bill 731? Unanimous vote, thank you.
Senate Bill 809. Senate Bill 809 requires the Office of the Comptroller, with assistance from the Department of Human Services, to study and make recommendations on the feasibility of establishing and operating a Supporting Our Caregiver Infrastructure program to provide universal monthly payments to a caregiver for each dependent for whom a caregiver provides care. There's two amendments. Amendment 1 is technical, and Amendment 2 changes the entity conducting the study from the Office of the Comptroller to the University of Maryland College Park.
Okay, so we have a motion and a second on Senate Bill 860.
809.
I'm sorry, 809, I moved down one. 809, all in favor? Unanimous vote, thank you.
Next is Senate Bill 860, which establishes the Aging Resilience Fund as a special non-lapsing fund to support implementation of the Maryland Department of Aging's mission. The fund may be used for administrative expenses that align with the department's mission, partnership development, and programs, services, or activities within the department. There's one amendment that specifies that certain money received by the fund is supplemental and not meant to replace other appropriations, prohibits the governor from reducing an appropriation to the fund in the state budget, and requires an annual report on deposits and expenditures made in the fund in the preceding year.
All in favor of Senator Zucker's, the chair of capital budget on SB 860? No, unanimous vote.
You know the governor's gonna have a thing here. We already passed it.
Next is Senate Bill 866, which requires each chain restaurant to display on each menu or menu board alongside each standard menu item with at least 1,150 milligrams or more of sodium per serving or at least 25 milligrams of added sugar per serving respectively, a high sodium content or high added sugars content warning icon and related text. Violations are subject to existing penalty provisions. There's two amendments. Amendment 1 is technical, and Amendment 2 alters the high added sugar content definition to 25 grams or more instead of 25 milligrams or more of added sugar. It requires the Maryland Department of Health to direct chain restaurants to its website to explain the requirements of the act. It requires accompanying text be displayed once on a menu rather than by each item with a warning icon, and it removes the requirement that the department submit a report on the implementation of the act.
And is it in the same posture as the House?
The House hasn't passed it yet, but they are intending on these amendments.
Okay, Senator Washington and Senator Gao, and Senator Reedy has a light on.
Yeah, so this seems to like, the amendments adjusted somewhat, but this is like it's still like putting a burden on, like 25 grams makes more sense than 25 milligrams, but 25 grams of sugar, that'd be like, any soda with regular sugar has 25 grams of added sugar per serving. Like a Mountain Dew a can of Mountain Dew has like 40 grams of sugar. I'm not suggesting that's a goal. I'm saying, so what does the amendment do? It says it only has to show up on a menu one place, or?
Yeah, so I guess originally what it had was that every time there was something that exceeded one of those limits, you had to both put an icon there and put this text that explained that it was high in added sodium and that's not good for you. And so now what they've changed it is you only have to put that disclaimer once on the menu. So like, you know, if it's a fast food restaurant that has a big board, they only have to have that on the board once and can just put the icon next to the individual food.
What about a restaurant that has menus? How does it work?
Yeah, so they'd have the icon on there and then would just have to print once on the menu that warning that explains what those icons mean.
I feel like a lot of chains are doing this already. I feel like a lot of chains already tell you there's high, it's like, yeah.
You know, you'll see at the bottom of a menu a little pepper, and it means this item's hot. And so
Right.
everywhere there's a hot or spicy item that has the little pepper, all this is saying is you would do the same thing with high sodium. More than 50% of the average daily sugar consumption for sodium or sugar would be no different.
Okay. The amendments make it a little.
For somebody that eats so healthy, you're having a lot of trouble with this.
Well, listen. Well, this is my deal. I just feel like we can't be everybody's parents. I mean, it's just like, what are we doing here? I mean, people don't know if they go to McDonald's, there's lots of sodium in the fries. Not a corporate sponsor, by the way, no. If we had commercials, though, for the streaming, we got a real opportunity. I mean, it's like, it's no offense to anybody. I don't understand. I feel like we're going so far on some of this stuff where we're like regulating everything. If you're ordering the chocolate lava cake, they got a lot of sugar in it. If you don't know that, I think we got bigger problems. Like.
Who's next? Senator Mounts.
Just quickly, and I don't want to belabor the discussion. I just know that some groups, specifically the Restaurant Association, I was just texting with Mr. Thompson. Apparently, they're working on some amendments, and so I was going to see if I could hold the bill one day and see what those amendments are and report back to you. If there is an amendment, then I'll just say there is an amendment. But I fully believe they're working on a legitimate amendment. I think sometimes I guess if you could say that, it's not a stall tactic to say they're working on it with the House. I think they're truly.
Senator, you're certainly welcome to hold the bill.
Thank you.
Everybody can get a hold.
And with respect to the sponsor, I'm not trying to slow it down.
Can we finish the discussion here in case there's more that we need? Senator Gao?
Yes, thank you, Madam Chair. So I just wanted to say this really quickly. I hear what Senator Reedy's saying about, being a parent to people. On the other hand, I do remember when restaurants were required to put, I think under the federal regulations regarding certain nutritional facts or information, and everyone discovered that Cheesecake Factory fettuccine Alfredo had like 5,000 calories. And like everyone was floored about this and that this is what you're consuming. When we talk about obesity in America, I think it also pressures some restaurants to reconsider the butter and the sugar and everything that they're putting in food. I mean, I do have some reservations about this, but I do really feel like I mean, it is out of control. It is absolutely out of control how much of the, how much sugar and salt and butter that are in a lot of the restaurant food, and I think is contributing to the obesity and poor health in this country.
And we are a committee that cares about obesity.
We are indeed. Thank you, Madam Chair.
Senator Lamb?
I'm still trying to get over the 5,000 calories in the fettuccine that I had at Cheesecake, but the technical, yeah, that's making me rethink what I ate, but I didn't know that. I just learned that. So a technical question, I guess, maybe for the sponsor. So, you know, this is kind of an opposite to what Senator is saying, but the amendment's moving from 25 milligrams to grams. That's like 1,000-fold difference there. Was that a drafting error, or was that an intentional change?
I think it was intentional change I think it was intentional change, and it aligns it with what they're doing in the House right now, what they're going to move in the House. So I think it's intentional to make it grams, because when you look at the menu behind some of the labeling, you'll see it's always in grams and rarely, if it's ever, in milligrams.
The drafter says it was a drafting error.
Oh, well. It was also a drafting error.
Or you can just say 25,000 milligrams. Right. All right, thank you.
Thank you. Senator Reader, back to you.
Yeah, just in response, look, obviously when I go in somewhere, having the calories up there, you know, is certainly a factor. But I guess my concern is, how far do we go here? Because we're going to start having icons for everything. I just think it's really interesting that, and I'm not saying the sponsor's doing this or not doing this. Everybody doesn't like the new health secretary at the federal level, but he's questioning a lot of the practices of corporations and what they put in the food. So it's like, I don't know, it just seems, and we're trying to like do everything we can to break away from his stuff.
Oil cap.
Well, but he'd probably be for this. So I just think it's interesting. Like, it's an interesting, I think there's a certain level of minding people's business that I'm just not that comfortable with, but it sounds like perhaps I'm a minority on the committee, so from that perspective.
The sponsor
thank you.
would like to make a comment.
Thank you, Madam Chair. I think this is about transparency in the food that we eat. And when we go to restaurants, we're hopeful that you think they're healthy meals because of what you're used to having at home or what you're used to having in other places. I think it's a step in the right direction of making sure that Marylanders have informed decisions before they choose a certain item on their menu. And I think this is about just ensuring that, like the Madam Chair said, we have that spicy label there that, hey, I'm not going to get that if I don't like spicy food, and I'm sure you appreciate that. Or if there's calories on the menu, you see that there's over 1,000 and you already had that hamburger earlier today, you decide, I'm not going to have this hamburger today. I'm not going to have this meal. So I think this is about ensuring we have informed decisions across the board in some of these. And it's not burdensome on the restaurants. Because we've made some changes to make it less burdensome on the restaurants. Thank you, Madam Chair.
Thank you. Again, you know, someone mentioned about the obesity in America. It's a real problem. One more little thing to help. But Senator Mouse asked to hold the bill, so you're going to get back to us if there's amendments tomorrow. So we're holding the bill. Okay, Senate Bill 910. Senator Mouse, this is your bill, but Lisa's going to explain.
We did that one at the beginning because we had revisited that one.
Oh, we already did, it's ours. I'm sorry. We did do that one. We already voted that one. Senate Bill 972, Senator Hayes' bill.
Okay. Senate Bill 972 authorizes the Baltimore City Board of License Commissioners to issue in the 40th Alcoholic Beverages District a Class B beer, wine, and liquor license for a restaurant on the odd side of 1000 block of West Baltimore Street if the applicant executes a memorandum of understanding with the Hollins Roundhouse Association. The applicant does not transfer the license to a different location or to another person, and the board waives the minimum seating requirement of 75 individuals. The bill also authorizes the board to issue in the 40th Alcoholic Beverages District a Class B beer, wine, and liquor license for a restaurant on the even side of the 800 block of North Charles Street if the applicant executes a memorandum of of understanding with the Mount Vernon Belvedere Association, and the board waives the minimum seating requirement of 75 individuals. There are 2 amendments from the sponsor. Amendment 1 is technical. Amendment 2 requires the board to waive any requirements that the alcoholic beverage sales may be made only to members and guests of members for a Class C beer, wine, and liquor license in the 1200 block of Utah Place in the 40th Alcoholic Beverages District. And the amendment also alters the boundaries in which certain alcoholic beverages license holders in the 40th Alcoholic Beverage District may not sell alcoholic beverages before 10 a.m. or after 10 p.m. There's no fiscal impact.
Senator Guile, who's the second? I'm sorry, who said second? Senator Washington. Okay, all in favor of Senator Hayes' Baltimore City bill? Unanimous vote, I think. Is that? Okay, unanimous vote.
I'm going to take over. Up next is Senate Bill 412, which as amended and for which you have a reprint, generally codifies the Community Forensic Aftercare Program within the Department of Health to monitor persons committed as not criminally responsible, which you may have otherwise heard of as NCR, who are on conditional release, and individuals with mental illness or intellectual disability who are required to be monitored under statutory provisions pertaining to individuals found to be either not criminally responsible or incompetent to stand trial. The bill also specifies some new requirements for the program, codifies the existing board, which under the bill is named the Community Monitoring Board, and that is consisting of licensed healthcare providers to make recommendations relating to conditional release and out-of-state travel requests as specified in the bill. And so the Department of Health must adopt regulations to carry out the bill. The amendments alter notice requirements related to when a forensic review board, which is a distinct board, but one that is already in current law based on legislation that passed last year. The amendments pertain to when that board issues a recommendation to a court. Those amendments can be found on page 2 of the reprint. The amendments further authorize certain authorized agents to attend forensic review board meetings virtually. You can find that on page 3. Amendments further alter the frequency of meetings between persons monitored by the new board, and that's on page 5. And then finally, the amendments delay implementation of the bill to October of 2027. That's on page 9. So the Department of Health advises that these amendments significantly reduce the fiscal impact. That's all I've got for this one.
That's it, huh? On the amended bill? Senator Guile, do I have a second? Senator Lamb? I was just looking, it was all favorable. There was somebody with amendments. I guess we did those amendments. For NAMI, were they the NAMI amendments?
So the sponsor of the bill advised that he has engaged and worked with on consensus amendments primarily with the Department of Health, who are responsible for the program, and secondarily with OPD and AFSCME, who represent the monitors.
Okay.
And those monitors also work with the state's attorney's offices, including Baltimore, and so that he would characterize it as they have incorporated as much of their input as possible.
Thank you. So we have a motion and a second. Senator Washington, I'm sorry, Senator Washington?
Yeah, thank you, Madam Chair. I did see, I think I saw this program in the budget today that was proposed, and I wondered, I think you guys were getting to the point of the Department of Health having a letter of support, because I know that's really important to have. Do we actually have a letter of support from them? I was looking through the committee testimony. I didn't see a letter from them on this bill.
The information that I have from the department is what I would call updated fiscal impact, right? They say that reducing some of the amendments would effectively allow them to reduce some of the staffing that had resulted in, I think the number was So the dollar amount in the fiscal and policy note, the net effect is approximately $160,000 a year. MDH advises that, as amended, the bill would likely, they would likely incur costs of approximately $96,000 per year. And so the email from the department, I would say, does not say that they support with amendments specifically. It just provides this updated fiscal impact.
But it's not opposition.
It do not say, please don't do this, or please don't pass the bill. That's not part of the discussion as it was relayed to me in this email.
Okay, I know that this committee cares a lot about these letters from MDH, so I just wanted to make sure that we had a letter from them.
Thank you, Senator. Senator Matt.
Thank you, Madam Chair. I had a question about the funding. And I guess it alters, the bill alters the Cannabis Regulation and Enforcement Fund, the CREF fund, which I believe is the fund that provides funding to local governments. Is that
Are we
right?
on Senate
Is
Bill
it-
412?
No, I'm not.
Okay.
I'm trying, I'm on the wrong. bill.
We're on page 1 of 2.
You're right, you're right.
Senate Bill 412.
Wait a minute.
Maybe you're at the top of the page, plus 61, but we're about halfway down at Senate Bill 412.
The one that says, has my name, the first one that has my name next to it.
Oh, that's why.
You're challenging us today.
We had to change the order for the reconsideration.
That was my St. Patrick's Day joke. Just, thank you.
I believe there was a motion and a second favorable with amendments.
Do we have a unanimous vote? Senate Bill 412? Do we need to call the roll? Okay, unanimous vote. Thank you.
Next bill is Senate Bill 555, which as amended establishes the Dementia Services and Brain Health Program in the Department of Health to lead the state's public health efforts relating to brain health and dementia. Let's see, by October 1, 2027, the department, in partnership with certain organizations with expertise in Alzheimer's disease and related dementias, must establish and maintain a provider resource toolkit. You'll see that in the bill, the reprint that's before you. A provider resource toolkit for dementia care for healthcare providers. And then by January 1, 28, and then annually thereafter, the department must review and update certain information in the toolkit. So the amendments alter the name of the toolkit from clinical to provider resource toolkit as described, delays the date by which the toolkit must be established, and specifies that the toolkit shall be comprised of existing materials and expertise or obtained through partnerships with other organizations as necessary. The department advises that as amended, there is no fiscal impact. And there was no opposition at the hearing.
Do have a motion for this good bill?
Yep.
Senator Guile. Who would like to second it? Senator Mounts? All in favor of Senate Bill 555? I'm going to say 9-0. You'll have to maybe get Senator Reedy when he comes back. Thank you.
The next bill on the list is Senate Bill 721, but I believe Senator Kramer was to ask to hold this bill.
Yes, Madam Chair, I would ask that we please hold this bill. I understand there's some conversation between the House and Senate sponsors about it, and they're trying to work out some things, so.
Thank you, Senator.
Next on the list is Senate Bill 772, which requires the Department of Health to coordinate with specified entities to develop and maintain an employment training and opportunity database to provide individuals in the state with assistance finding employment training and other opportunities that may enable them to become eligible or to remain eligible for Medicaid and SNAP. So this bill is related to the effects of H.R. 1, which established certain work requirements for those programs. The Department of Labor, the Secretary of Human Services, and the Department of Service and Civic Innovation must each establish a process through which a person may recommend a vocational workforce training or job placement program for inclusion in the database, and, if appropriate, forward a recommendation to the Department of Health for inclusion in the database. The bill terminates September 30th of 2029. There are no amendments. There was no opposition at the hearing.
Thank you, Senator Gao. Can I have a second? Senator Kramer? Yes, ma'am. All in favor of Senate Bill 772? Okay, do we need to call the roll? Senator Mouth, should we call the roll? Okay.
There was no opposition at the hearing.
Senator Hershey, you okay? All right, unanimous vote. Thank you. Okay. 792.
Yes, Senate Bill 792, as amended, requires a hospital to adopt a policy describing the protocol of the hospital when there is an immigration enforcement action at the hospital, and that policy must be consistent with guidance that has already been provided by the Office of the Attorney General. The policy must be available to all hospital staff members, and the hospital must annually provide training to staff to ensure understanding of the policy. The amendments strike provisions requiring HSCRC to develop a model policy and instead require hospitals to adopt their own as described. There was no opposition at the committee hearing. With the amendment, there will be no fiscal impact, and the Hospital Association supported the bill with the sponsors' amendments.
Yeah, sure.
I guess this is for the bill sponsored. Does it lays out exactly what kind of training that is? Is it like virtual training or flyers?
Sure. So healthcare workers in hospitals oftentimes have to go through annual training on a whole variety of things, like bloodborne pathogens, if there's a mass shooter in the hospital, things of that nature. And so it's part of our training every year that you have to do. It's usually like an online module.
Right.
You just have to kind of sit
familiar
through.
with that.
Yeah.
That's what
So it would just be included as part of that, because oftentimes we've heard from healthcare workers that they aren't sure what to do if a federal agent shows up in the emergency department. We just want to make sure everybody knows what to do, what the protocol is, and what they should be following on.
Thanks.
All right, I think we have a motion and a second. I think we'll call roll on Senate Bill 792. Something different.
Okay. Senate Bill 792, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes. It's not like
Yes. Senator Mounts.
getting their way.
Yes. Senator Jackson. Yes. Senator Washington. Yes. Senator Guile. Yes. Senator Lamb. Yes. Senator Hershey.
Yes.
Yes. Madam Chair. Yes. Unanimous.
Next, Senate Bill 974 establishes that the inspector for the Caroline County Board of License Commissioners must be either an individual appointed by the board or the county codes administrator. Currently, statute specifies that the codes administrator will be the inspector. There are no amendments. There is no fiscal impact. There is no opposition, and the delegation letter is in the file.
Motion favorable to 974. Senator Mount, Senator Hayes. All in favor of Senate Bill 974? Thank you. Okay, now it is English.
All right, so we're going to be at the top of page 1 of 2, kind of gone in backwards order here with Senate Bill 61, which has already been voted favorably out of JPR. Finance is second on this bill, which generally establishes, has introduced a release preparation program in the Division of Correction. DOC must establish and submit for approval to the Office of the Attorney General a protocol for registering formerly incarcerated individuals in the program to have access to state correctional facilities for the purpose of assisting incarcerated individuals with release preparation. Also, as introduced, the bill altered the purpose of the Cannabis Regulation and Enforcement Fund to include providing funds to cover the costs of supporting this new program. You do have a reprint, though. The bill was heavily amended. The program has been renamed the Volunteer Services Program. And then further down on page 1 of the reprint, you'll see that all of the alcohol beverages and cannabis article provisions have been struck from the bill. The bill no longer affects the Cannabis Regulation and Enforcement Fund, which is largely why Finance even had jurisdiction and was assigned this bill. The alters the program to be a volunteer services program, and the DOC still has to establish a protocol for registering volunteers. And DOC now must maintain, rather than make publicly available, a list of registered volunteers that are participating in the program. Also allows an individual to not have their name be made publicly available, but they could register with a volunteer organization who could then be contacted to get their name. And then that's the process that is used on the back page to connect volunteers who do not want their information public, is that process there on page 4.
Senator Reedy has a question.
Where to begin? I'm all for volunteers going into prisons and helping inmates, including people who are about to be released. I've done volunteering in prisons myself. A little concerned about, even after all the amendments, we've got organizations led by formerly incarcerated individuals. Now, look, I'm reading Chuck Colson's autobiography from the 1970s right now, so he was a formerly incarcerated individual. So I'm not saying that's all bad, but you're having that as part of a protocol for registering people. We've had some high-profile stuff in the news about stuff going on in some places where there's former incarcerated individuals, involved in things, street activity. It's supposed to be positive, but we're not sure. There's a lot here. Was there a reason? Originally, they were going to have an individual be public. It was going to be public if you were involved in this. And so now we're saying it doesn't have to be public. It would just be maintained.
Sure. So initially, the list of volunteers that were participating in the program was going to be a public list, and they've altered that so that the volunteer's name could be public, or it could be connected with an organization or another person that could be contacted to be connected with that volunteer who didn't want their name to be public necessarily.
I wouldn't necessarily mind it if it was that the Division of Corrections is going to maintain the record and then it could be publicly accessible. I understand the idea of not wanting to be on a website somewhere, but I don't know. This trying to help people that are about to re-enter is definitely a noble thing to do and a good thing to do. I just have a number of questions. So I think that, Madam Chair, if I could hold this bill and maybe we can
I would reiterate that the whole reason Finance is even assigned this bill has been amended out of the bill.
Oh, so
Because
it's already.
the Cannabis
I
Regulation
missed
and
that part. I'm
Enforcement
sorry.
Fund is the reason we have
All right.
jurisdiction.
Well, look, I mean, I'm probably just going to vote against it. I have some concerns about this, not about the overall program, but just about several things here. So, okay.
Okay, let's see, Senator Mouse?
Just bring up a question I misplaced earlier about the funding.
Yes.
So it's drawing funds from cannabis sales and use tax.
It is no longer doing that. Those provisions have been struck from the bill. So that's no longer being added as a purpose of the Cannabis Regulation and Enforcement Fund, and those funds will not be used as part of this volunteer services program. It'll just be run by DOC within their budget.
By the Department of Corrections.
Yes, under the Department of Public Safety and Correctional Services.
And does this increase their budget to fund it, or do they already have the budget to fund it? There's got to
So
be
the-
increased.
Fiscal note is a little bit unclear with that. It really depends on actual experience under the bill and how many volunteers would want to register for DOC to then actually have to perform this protocol with those registered.
And would this be classified as mandatory spending or discretionary spending?
To the extent that it costs them money to put this program in place, it's just establishing the program. So I assume to establish, if it costs money to establish a program, that would be a mandated spending they have to do because
Kinda way
it's
out.
connected to the program.
All right, thank you.
Okay. So again, we were secondary on the bill. The reason we were second has been removed from the bill. Can I have a motion for Senate Bill 61? Senator Guile, can I have a second? Second, Senator Lamb. All in favor of being the second on Senate Bill 61? Let's call the roll. Tammy, please.
Senate Bill 61, favorable with amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yes.
JPR
Yes.
already voted.
Senator Reedy?
We're voting second.
No. Senator Mounts? No. Senator Jackson? Yes. Senator Washington? Yes. Senator Guile? Yes. Senator Lamb? Yes. Senator Hershey? No. Madam Chair?
Yes.
Yes. 7-3, bill passes.
Okay.
Right, the next bill is Senate Bill 389. This is the transit-oriented development bill. It's an administration bill that, as amended, makes several changes to the state law related to transit-oriented development. In general, the bill prohibits local jurisdictions from imposing certain off-street parking and other land use limitations on TOD projects and prohibits the collection of local development impact fees or excise taxes from certain TOD projects before construction is completed. Yes, sorry. Yeah. Yeah. There are several amendments to the bill, and you do have a reprint in front of you. Amendment 1 is technical. Amendment 2, working through here, the reprints at page 3. It allows or requires local approval for a transit-oriented development to be an enterprise zone rather than it being an automatic designation as enterprise zones. That was an amendment requested by MACO and MML and offered by the bill sponsors. Moving to page 5, this amendment expands the bill to land owned by Baltimore City or the Washington Metropolitan Area Transit Authority to also be used for the TOD projects in addition to state land. Page 6 is a technical amendment. Page 8 defines what an adequate parking study means and that definition is then used on page 9, which provides a circumstance or exception for when minimum off-street parking requirements may be set by a local legislative body for a TOD project, and that would be if they've had the adequate parking study done within 3 years and the Department of Transportation concurred in the findings of the parking study. And at page 10, that's just another conforming change to add the TOD applicability to other landowners. Page 11 is another technical amendment. Page 12, you'll see a whole section from local government struck that is being added in back in at the end with some new language. So that gets us to page 14. At page 14, this amendment at the top strikes language removing the scoring preference for a project labor agreement. And then the next amendment adds a new section 3. This is the language related to excise taxes and impact fees that will apply. And this section 3 has been made contingent on the failure of the Maryland Housing Certainty Act. So if the Maryland Housing Certainty Act passes, which it will be on second reading, I believe tomorrow it has passed out of EEE, the provisions in that act will control for excise tax and impact fees when they are paid. They largely mirror what you see in the bill, but they are slightly different as far as how long you can pay it out. I will go over what's in that bill. But what would apply if those acts pass and what's in this bill maintains the prohibition that the locals can't accept the excise tax or impact fee can't be collected until after construction is complete and all requirements for a certificate of occupancy, occupancy permit, or local equivalent has been issued. However, any county municipality that does impose an excise tax or an impact fee under this bill can revoke the certificate of occupancy or the occupancy permit or the equivalent if the fee or the tax is not paid within a reasonable period set by the county or municipality. And then just further down in section 5, that is the provision, the uncodified provision there that's making the excise tax and impact fee provisions contingent on the failure of the Maryland Housing Certainty Act. And just what is in the Maryland Housing Certainty Act, so you know what will take place if this passes. The provision that is largely different is that a development excise tax or impact fee imposed on a residential real estate project in this article may be collected as a precondition to conducting a final inspection, but not more than 30 days before the date of that final inspection. So it adds that extra provision for impact fees and excise taxes that's not in the bill before you.
Okay.
I know this is a lot, so if you have any questions.
We'll start with Senator Kramer.
Where was that language you just read that, and I know it was something that I had asked about, any excise tax or development impact fee being collected as a precondition to conducting a final inspection. So that would allow a jurisdiction to collect it prior to that final inspection, and except not 30 days before.
Correct.
And where is that?
And that is a provision that is in Senate Bill 325, which is the Housing Certainty Act that Section 3 is contingent upon. So if the Housing Certainty Act passes, and it will be before the full Senate shortly at their next session,
so wait a minute.
That is the language that would apply. So that language is not in the bill or the reprint that you have in front of you.
It is not.
No, that
Okay.
is what will apply if the Housing Certainty Act passes. And Section 3 of this act and the language in here about excise taxes and impact fees will never take effect.
Okay, hold on. I am so confused
Okay.
right now.
Can
There's,
we just have the conversation that it's going to pass if it's on second reader already? Would it be easier
What?
to understand it?
no, okay, so there's a separate bill
Yes,
that has the language you just read.
correct.
And what bill is that? Senate
It's-
Bill what?
325, also known as the Maryland Housing Certainty Act.
Okay. And that language that you just read is not in Senate Bill 389, but it's in Senate Bill 325.
Correct.
And if Senate Bill 389 passes, can it pass without 325? It could.
Yes. So what happens?
So how does that then
Yep.
get the language that I'm seeking into the bill? Do we need to have it in 389? I'm confused by that, because we could pass this bill and then not get what I know Montgomery County is seeking, because this comports with the general concept of put the impact fees at the end of the project, which this would, but we already have in process this place of doing it right before final inspection. So it's a little bit different than is stipulated in the bill before us.
Right.
Can we put it into this bill so that we don't risk passing this bill and not the other one, and then we do not have the language that I'm trying to incorporate?
That is a policy call, and if you would like to present an amendment, I'm sure we
I
can do that.
think you have the
I mean, I
amendment.
definitely have the language.
I actually think you have the drafted amendment. It came, so the one that you just read came this afternoon. I've got a copy of it here if you would like, but it's drafted to Senate Bill 389.
Okay.
Can we either hold the bill for a day till tomorrow and then adopt that language?
You have the amendment now?
I do.
And I do have the exact language as well, so we could vote on the language that I've read as an amendment to 389.
That would be great. That would be wonderful. Let me just make sure it is this one that you have. Okay.
Got it.
Okay, then I would ask that
It's not in this reprint, but it is in the amendment system.
Will you tell us again what it says?
Yes. So the one difference between what's in the Housing Certainty Act and what is in the Transit-Oriented Development Bill is this provision that says a development excise tax or development impact fee imposed on a residential real estate project under the authority granted in this article may be collected as a precondition to conducting a final inspection, but no more than 30 days before the date of that inspection.
And it won't conflict if that other bill does pass, right?
So that is what the contingency does to make sure that the two areas do not conflict.
Okay.
If the Housing Certainty Act passes, Section 3 of 389 never takes effect. But if the other bills don't pass, 389 takes effect in entirety.
Thank you. All right, let's start with, go ahead, Senator Hershey.
So, again, I'm trying to figure out why we're connecting the two bills, but if we accept Senator Kramer's amendment, it would still be overridden by 325?
Yes, just so that they don't have both provisions in law.
But what's in 325 is similar to what he's asked for?
It's exact same
Exactly
language,
Okay,
yes.
so he's just putting it in case. that
It'll be in
doesn't
both
pass.
places, yes.
Okay, and then so what was the original bill as far as how it dealt with impact fees and excise tax?
So largely, this is how the bill was introduced, is that they were to be paid at the end. And this is the one area where I believe that negotiations between MACO and the other locals couldn't reach a firm agreement on this one. So I would say that MACO is probably still opposed to this provision.
But when you said at the end, because Senator Kramer's amendment now talks about final inspection. At the end, was that defined on the bill as submitted? I mean, I'm trying to figure out how much this has changed by this amendment.
So as the bill came in, the impact fees and excise tax could not be paid until, or could not be collected or billed by the county until the project was complete and all requirements for the certificate of occupancy were met. This adds an exception in Senate Bill 325 that a development excise tax or impact fee imposed on a project may be collected as a precondition to conducting a final inspection. It would just add that as a second option.
So you're just saying within 30 days of asking for the final inspection, then the county could ask for the taxes then?
Which is also at the very end of the
Yeah.
project, I mean, it could be that under the way the bill is now, it may come due sooner, or depending on, because bottom line is, final inspection is when it's going to be completed.
Correct, okay.
So, but
I would say, so either way, that what the bill was seeking is that these impact fees don't have to be paid up front.
Correct.
They can
That's
be
right.
paid, and how we're defining it, the end now, is just more specific with yours and stating
the 30 days.
It's the final inspection. Okay.
Got it?
Yes, ma'am. Thank you.
Let's go to Senator Washington.
Thank you, Madam Chair. I was looking at page, I guess it's new bill, page 9. And it says, since we're including WMATA, it initially came in and it did not include WMATA, and it just didn't include WMATA, and now that it does, it covers all of our metro stations in Prince George's County. And in here, on the page 9, it says that on, I guess it'll be lines 19 through 20, but subsection 3, 1 and 2, 3 years prior, there has to be an adequate parking study if they wanted to limit parking or change parking.
Correct.
And a lot of these projects happen in phases, and the counties don't do 3-year parking assessments. I don't know how long they take either, but requiring them to do an assessment every 3 years just because there's someone else that wants to build on a second parcel next door, it might take a little over 3 years to build next door, but then we're requiring them to conduct another parking assessment. Is that right?
They're not required to conduct the adequate parking study. It's just if they want to have limitations on off-street parking, that is the contingency they have to meet. They have to conduct the study, and MDOT had to have concurred in the findings. The study doesn't have to be conducted every 3 years, but it has to be within 3 years of this project, when you're doing this project, for this study to apply to that project.
Why would MDOT have to approve a parking study for WMATA property?
Yeah, it might need, with the land use portions, I'm not as familiar.
This is unusual, but there's somebody here from MDOT that can help us with that answer. if you don't mind.
Thank you, Senator. Drew Morrison, Senior Policy Advisor at the Maryland Department of Transportation. What we were trying to do, there was interest in bringing in WMATA property into these provisions because the bill focused on state-owned property, which is largely the MTA system, as you know well, and so to bring a little parity into some of the TOD progress that we're hoping for. And what we wanted to do on the parking provision, which it just says within a quarter mile of these stations, and that was existing within the law. The WMATA provision has to do with zoning. So we were already looking at these parking provisions around WMATA stations in the original bill. And initially we said within a quarter mile, you could not impose a parking minimum in your zoning code. So within a quarter mile, you couldn't say 2 spaces for a housing unit or anything. What this says is the local jurisdiction would like to do that and say, hey, we need some parking to deal with the challenge that we're having here. Then the local jurisdiction needs to do a parking study around that transit station. But we want to just make sure that as transportation experts that we're aligned on that vision and we're not providing excess parking around a transit station. So we would work with the local jurisdiction to align on that parking study to make sure that we're on the same place in terms of the vision for the future of that station.
Well, MDOT is a big bureaucracy. And going through MDOT to get an approval for anything takes almost a year or 2 for anything. And so what you're saying is if a locality wanted to limit the amount of parking or make sure there was enough parking there, they would have to create a study every 3 years, essentially when a new applicant comes about and wanted to change some of the zoning there. Maybe that's one time, they can do it one time for the entire project too. But they would have to come to WMATA to ask for approval for what they would have to come to. I'm sorry, MDOT for approval of a study.
Right, to impose a parking minimum on that quarter mile around the station, correct?
Does MDOT have jurisdiction over WMATA currently of those types of zoning projects right now? A current law. Is there a law, not this provision in this bill, but actual law?
I would say today the way we engage in local zoning provisions is when we do our transit-oriented development designations, we do review that the local jurisdiction's zoning and planning policies are supporting transit-oriented development if they're going to be seeking designation. But I would agree that this is a new approach. This tries to balance the original language of the legislation, which just flat out prohibited minimum parking requirements within a quarter mile. So this was an effort for us to try to balance that original language to make sure that there is an opening, but that it is a dialogue as well.
I appreciate the flexibility that you guys are trying to do, but I think it does put another barrier over the approval process for some of these zoning changes. That is already a long, lengthy process. We have a lot of stations in Prince George's County, and having another bureaucracy over whether or not I want to have amount of zoning just doesn't really, and no offense, but MDOT does not do well at getting approvals done quickly. So I would just ask that we revisit that and see what we can do to make a.
Senator, can I add? This was a request of MACO. This was the
This
MACO
language?
parking amendment. Yes. MACO felt like they didn't have enough input and they didn't want MDOT being totally in charge. So I call this the MACO amendment.
But did they ask for the approval of MDOT to approve a WMATA? I mean, MACO doesn't. Prince George's County and Montgomery counties oversee our WMATA, not MACO, and so it's a little bit more sensitive to us trying to develop around these stations and then having to go through another level of bureaucracy for approval for us trying to have more trans-oriented development. I get that. Look, I support the bill. I support the concept. I just don't want bureaucracy holding up what we already have as a protracted process of zoning in Prince George's County and sometimes in Montgomery County too.
And I'll say two things. One, we did align with MACO on this language. So MDOT and MACO and MML were aligned on this. And really our hope is, again, in most transit-oriented developments, we expect that within a quarter mile, which is fairly tight, a parking minimum really isn't required. I know that some of the challenges we've seen in Prince George's County is when we have particularly townhouse development that's a little more peripheral from the transit, and we have that overflow of parking, that's been a local concern. But that when we're really close to transit, we think most of the time the parking provided by the market will be sufficient. And we see this as the exception, not the rule. And that's why we thought this was a balanced approach.
Got it. Thanks for that. And just my last question on this is the problem about, receiving the funds after the approval process for the permitting fees after the process. Is this also a MACO approved language in here too for them to receive it within a time certain after the project is done? Is that approved by MACO too?
So there is an ongoing conversation around the impact fee provision. And part of why this language is contingent is to allow that conversation around the Housing Certainty Act to continue. I know there's a set of questions from Prince George's County based on the way that impact fees and taxes are applied to debt service. So what I think we would say is that we expect Housing Certainty Act to lead in a countywide and statewide approach on the impact fee sets of issues. And that's part of why the contingent language is here, and we'd continue to work with council and the Senate on the final resolution of those issues.
So we're still working on that.
I think, Triple E passed out the Housing Certainty Act.
Yeah.
And so we expect the Housing Certainty Act to continue to make progress and to pass and to be the ultimately, governing set of language related to this issue, which does address the item that you raised.
Got it. Thank you.
We're good? Okay. Senator Gao.
Thank you, Madam Chair. I don't really have anything substantive. I was just forgot to be added as a co-sponsor. So if you wouldn't mind taking care of that, Amber, I would appreciate it. Thank you.
I'm a co-sponsor.
Yeah.
Anybody else want to be added as a co-sponsor? This is the governor's bill. Senator.
You are.
Yeah. We had that opportunity. Drew, thank you for all your help and input. I know it's been a lot of work and a lot of amendments, but I hope we're on our way to finalizing this, so thank you. Can I have a motion to?
Favorable as amended and with Senator Kramer's proposed language added to the impact fee and excise taxes.
I thought, when I asked you, were you okay? I thought you meant you were okay to go forward. You mean you still want to hold it? No, well, he got his amendment in. Okay. Are we okay? The House is kind of waiting on us, so.
I still would like to have a conversation with my county, particularly about that language around the parking. for potential
Okay.
floor
Can
amendments.
you
So I
do
won't-
that by tomorrow?
I will.
I would like to have it back on the voting list by tomorrow.
Sure, thank you, Madam Chair.
Thank you. Okay. Holding it till tomorrow.
Can you re-summarize what you guys
The next bill on your list is Senate Bill 757, which is, as amended, requires Commerce to develop and maintain a searchable online database to be known as the Maryland Local Sourcing Portal to connect businesses in the state with local sources for tariff-impacted goods and other supplies. By December 31 each year, Commerce must report to the General Assembly on the use and effectiveness of the portal, and the bill sunsets September 30th of 2031. Amendment 1 is technical, and Amendment 2 addresses all of the unfavorable testimony by striking the consumer protection provisions from the bill. The title is also altered since this is no longer consumer protection, but more of an economic development database to help local businesses find goods that have local sources for goods that are therefore not impacted by tariffs.
Any questions? Senator Mounts.
Yeah, the fiscal note talks about criminal and civil penalties.
Those are under the Maryland Consumer Protection Act, and those provisions have been struck from the bill.
Oh, if they've been struck from the bill?
Yes. There's, the only thing the bill does now is create a local sourcing database. It's established within Commerce.
Thank you.
Thank you, Senator Washington. Do I have a second? Senator Guile? Sure. Go ahead, Senator Reedy.
Who's going to do this? Like, how do you even figure out? Some stuff, it's like obvious what there's a tariff on, but it's changing all the time.
So if you work in the industry and you provide a source of a good that you know is there's big importers for them, and those products are being affected by tariffs, you as a small business then may want to have your name in this database so other people in Maryland can come buy from you as a local source that doesn't have a tariff on its goods because it hasn't been imported.
Huh. So in other words, doing exactly what the Trump administration tariff goals are.
Yeah, ruin the economy.
Well, no, get you to buy local.
It helps to find those local
So
sources.
Senator Rosapep's bill is a pro-Trump bill. Interesting. I have to think about this. Okay. I just wonder if maybe we can get the nonprofit coordinator to also do this.
We have a motion and a second. Tammy, please call the roll.
Madam Chair, just one.
Okay, I didn't see your light. Sorry.
Sorry, figure out who's doing this, but the department secretary is supposed to be the one that figures this out?
The Department of Commerce has to set up the database, so the Department of Secretary would likely outsource this to IT or contract with somebody. There was some costs related to setting up the database.
But it says that tariff-impacted goods means the commodities, supplies, or raw materials identified by the secretary as subject to federal import duties or trade volatility. So the secretary is going to figure out?
The secretary identifies which types of goods would be, let's see. Where in the bill, what page of the bill are you on?
I was on page 2, the part under economic development. Line 20.
Yes, they're having the department, the secretary determine which goods the federal import duties have affected. So a list of what types of commodities or supplies and materials are affected by the current
But we don't,
tariffs.
Is there any indication, though, that that has affected prices? I mean, is there a comparison of something, or are you just saying that, you know, what we hear on the news every night, that certain goods are subject to tariffs?
The way that the bill is written, it is just that the good has been impacted by a tariff. And that's what the bill.
Did we hold this yet, Madam Chair? Until next week. It's just ridiculous.
Let's just, if you don't mind, let's just take a roll call. I don't think your vote be any different today than it's going to be next week. Why do I have that feeling?
Be different June 15th, April 15th. All right.
Can you call the roll?
Senate Bill 757, favorable with amendment. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
No.
No. Senator Mounts.
No.
No. Senator Jackson. Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb. Yes. Senator Hershey. No. Madam Chair.
Yes.
Yes. 7-3, bill passes.
Thank you. Okay.
Next on the list is Senate Bill 869, which establishes the Maryland Workforce Launch Pilot Program within the Department of Commerce to provide customized, no-cost workforce training as a business attraction tool to recruit strategic industries and qualified business entities to the state. Commerce must partner with no more than 2 community colleges to deliver training services and must distribute funds to a partner community college to cover the direct cost of developing and delivering the training. The bill specifies that any curriculum, manuals, or instructional materials developed under the program are owned by the community college, and the bill sunsets September 30th of 2029. There are no amendments, and there was no opposition at the committee hearing.
Do I have a motion for Senate Bill 869? Thank you. Senator Guile, can I have a second? Second, Senator Washington. All in favor of Senate Bill 869? It's a unanimous vote. Thank you.
And last is Senate Bill 905, which establishes the Maryland Advanced Manufacturing Grant Program and related special fund administered by the Maryland Technology Development Corporation, known as TEDCO. The purpose of the program is to support the growth of companies specializing in regenerative medicine and other advanced manufacturing. TEDCO must establish eligibility criteria, grant application evaluation criteria, and grant award procedures and amounts. TEDCO may also adopt regulations necessary to carry out the bill. You do have a reprint in front of you. The amendments of the reprint begin at page 2. The first amendment on page 2 strikes the Stem Cell Commission as consulting on the entire program on this page. At page 3, the fund is being authorized for TEDCO's administrative costs. And then further down in the new subsection F, we're replacing the Maryland Stem Cell Research Commission to that TEDCO must consult with them on items related to regenerative medicine under the program only, including establishing criteria or procedures specific to regenerative medicine or adopting regulations.
Do I have a motion favorable for Senator Washington and Senator Kramer? All in favor of Senate Bill 905? Unanimous vote. Thank you. All right, so I'm going to... Tomorrow, we held Senate Bill 623. There's work going to be done with Howard County and Prince George's County. We held Senate Bill 866. I think we're waiting. Senator Mounts, were you going to get some information? Somebody asked to hold it for information. The added sugars and sodium. We held the Governor's Bill 389 because we want to hear the senator from Prince George's wants to hear more from his county. And we held Senate Bill 721 just because somebody's working purposes of an amendment. So that's 4 bills tomorrow that we're going to add on to another list. Thank you all. We will be meeting tomorrow in between the floor session 1 and floor session 2. You might want to bring your lunch. Thank you.